Well, then, Western Cape officials are now doing their best to try and manage a COVID-19 outbreak in the province. It's among the 3 provinces in the country currently recording the highest number of cases. It's recorded just over 2,000 positive tests. That's in the last pandemic update from the National Institute for Communicable Diseases. The province has over 12,000 active infections. Premier Alan Winde has warned that the number of people who are being admitted to hospital for COVID-19 related care is also rising, and joins us tonight to talk more about this, I believe, from Cape Town. Premier, a very good evening to you. Always great to speak to you. So far this week, the Western Cape has recorded 1,500 and just around 2,000 new daily infections. Are you less stressed in this wave than you were this time last year?
I don't know if that's a fair question. I thought I was last year, and then we were hit with a different variant, and it seems like deja vu now with a new variant. So I wouldn't say that I'm less stressed. I mean, I know that our system can cope, but you don't know what you don't know. And this Omicron virus or variant, we don't actually know the full complexity of it as yet. I think so far so good. So if I judge what's happening in Gauteng, it looks like less oxygen use and definitely less severe in hospital. But I think it's still early days. We'll see over the next week or so. And we've now entered, as of Friday at lunchtime, we entered into the 4th wave.
And of course, the Western Cape, like many, especially coastal parts of South Africa, is in a somewhat unique position in that you're likely to see imported infections of people who will be coming over there for the end-of-year holidays. Do you think you will probably get a true sense of how you are likely to emerge out of the 4th wave only around January as the tourists leave?
Yeah, I would imagine so. But this is where this year is so different from last year, because we have got over 50-year-olds vaccinated in fair numbers, especially in our coastal regions, whether it be the Garden Route or the Overberg region or the West Coast or the West Coast, as I refer to it. I think these regions, 50 and over, are all in excess of 60% vaccinated, of 50 and over. And I mean, in the Garden Route and the Overberg, it's sort of over 70 and sort of 75%. So that must play a role. We're seeing less people in hospital and less people with severe complications in highly vaccinated areas in Europe. So we presume that that's going to be the same. So that obviously will be a mitigating factor. Of course, people coming to the province, we welcome them to the province, but we also say, please, you must be aware, you must be safe. We need people to follow the sort of non-pharmaceuticals, so that's the masks and the social distancing. Please keep it outside, keep it small. And we're also saying to the businesses, you also need to play your role. If we want to get the balance right of lives and livelihoods, and we don't want severe lockdowns, we've got to make sure our hospitals are kept open. And we're sitting at 6% now with hospitalization. We were at about 7 admittances a day a week ago, and we're sitting at 19 a day at the moment. So we're watching the numbers very closely, and we're asking citizens to play their part. And we've readied ourselves. We've got the oxygen, we've got the frontline staff, we've got the field hospitals. So we've put the required sort of mechanisms in place to deal with this pandemic, but we also it means government and civil society have to play their part, each responsibly.
So you're a tourist destination. Would you support vaccine mandates for public places such as restaurants and the various other spots that people visit during this time of year in the Western Cape? So,
I mean, from a policy point of view, we don't have vaccine mandates. We say it's a matter of choice. I always say that it's a wise choice. It's a scientific choice. It's a good medical choice. And I would say to businesses that obviously they can how they manage their businesses is up to them. I wouldn't make it mandatory, but what you do need to do is make sure that your businesses are social distancing. I think specifically the hospitality industry. We've got beautiful weather at this time of the year, so move outside. Get your tables and chairs outside onto the sidewalks. We need to make sure that fresh air is in circulation. That will also make sure we mitigate risk.
19,000 vaccinations reported in the last cycle. This has been This time last night, we're waiting for the next report due out about an hour from now, usually from the NICD. Are you satisfied with the pace of vaccinations, the rate of vaccinations in the Western Cape?
No, I mean, in the last couple of weeks, we've dropped down to even below 20,000 a day. I see them coming up again in this last week, we had a couple of days where we were over 20,000, but we know we're near our capacity, which is in excess of 40,000 a day. And specifically those that are at risk. We've got some good percentages, but there are parts of our province where we still have got a lot of work to do, and especially elderly people. We need to make sure that we're mitigating risk as much as possible there.
Just on vaccinations, Premier, you've just said you're not in favor of making vaccinations mandatory. You've got a lot of debate going on currently, even between the labor unions and other people who are saying they don't want their employers to say to them, you should actually be vaccinated for COVID-19. The goal for government at the beginning of this year was to vaccinate about 70% of the eligible population. That's clearly not going to happen. Do you think we simply have to accept at this point that we're very unlikely to reach that target?
I mean, maybe next year we might reach it. It depends on what happens during this wave. Automatically, you could see as we came off the last wave, you could see the numbers starting to drop of people queuing up for vaccines. Now that we see another wave coming, suddenly people are waking up and saying, oh, well, I didn't get around to it, so now I'm going to go and quickly, get the vaccine. I just hope it's not too late. And of course, we must remember that we're in the fourth wave now. There's nothing to say there won't be a fifth wave or a sixth wave. So there's no time like now. So get in the queue, go and get your vaccine. We've got vaccine sites and mobile sites all over the province, and please make use of them.
Western Cape Premier Alan Winde, always good to speak to you. Thank you for your time tonight, sir.